We want to get your question answered from the head of the St. Louis Metropolitan Pandemic Task Force. Dr. Alex Garza is also Chief Medical Officer for SSM Health. He joins us live this afternoon. Dr. Garza, this is becoming a standing Friday afternoon appointment between us.
Yeah, good afternoon. How are you?
I'm doing very well, thank you. We appreciate your time. Well, we have seen a small spike in actual cases the past few days in Missouri and the region. How concerned are you about that continuing as now St. Louis City and St. Louis County will start to reopen in the next 72 hours?
So, well, as you know, we're always looking at the data. I think the important thing for us is, in addition to looking at the cases, when we look at our incidence, admissions, and our hospitalization data, those continue those downward trend. And so we're pretty confident that we've suppressed transmission of the virus just looking at the data that we have. We're getting a little bit more data on where those cases are coming from. And so we're feeling more confident as we continue to see those numbers staying so low.
Obviously, you and your team are always planning for what's next, any possibilities down the line. So give us an idea what specific numbers you will be watching for next week to determine whether the stay-at-home orders were lifted too early.
Yeah, so the challenging thing with looking at these numbers is they're usually a delay. And so if you think about the natural progression of the viral disease, somebody has to be exposed, then they have to become infected, and then they have to, develop the infection, and then that's when they would present to the hospital. And so that can take anywhere from, a week to 2 weeks. And so that's always a concern that, you're a little bit delayed in finding the signal. But we look at that admission number, which is about the earliest that we can. And so we'll be looking at that starting, we look at it every day, but we'll be trying to time it out from when the relaxation orders occurred to when we would realistically see an increase in the number of admissions.
In just the past half hour in your press briefing at 3:30 this afternoon, you showed us a bunch of slides and you talked about if the reproductive factor of COVID-19 jumps to 1.5. Is that a worst case scenario for you here? And what exactly would we have to do if we get to that point? Explain all of that for us.
Yeah, so, a worst case scenario would be, if it went all the way back to where we were pre-COVID, which is a reproductive factor of 5. So that could be your presumably worst case. So this is still a worrisome case, though, right? It's nothing to laugh at. So that reproductive factor going up to 1.5, showing that increase in cases on a second surge. So that is concerning. And so how do you prevent that from happening? So you prevent that from happening by doing all of those practices that we've been preaching that everybody, I think, more or less has been doing, like wearing the masks in public, washing your hands, all of those other things. But, we're always concerned whenever you're taking your foot off the brake, what is this going to look like? How should we be preparing for it? All of those things. And so that's why it's important that we keep stressing all of those pieces of hand washing, all that stuff, but also keeping an eye on the data.
There is more FDA-approved antibody testing out there right now, some claiming to be 99% accurate. Do you recommend that folks get tested now? And if they test positive, what should they do with that information?
Yeah, so the antibody test it's challenging to give out precise information on that. So the tests that you're talking about, those are typically what's called the ELISA test. And those are very sensitive and very specific, so you can trust what they're telling you. The challenge is, though, what does that mean? So it doesn't mean that everybody is fully immune if you're positive. And so the best use for that data right now is really in public health and epidemiological studies, so that we know how much of the population has been exposed to the virus. But we don't know enough about immunity right now to say whether somebody is completely immune or partially immune or whether they can get reinfected. So it's good for public health purposes, but not super good for individual purposes.
As families sit down this weekend, before we let you go, obviously they'll be having conversations about what next week look like, if folks are returning to work or able to go to the store or restaurants. I'm curious what conversation that you're having with your family. Will you all be venturing out to restaurants and going to stores? What are you telling your family?
Well, of course, we won't be doing it until after shelter-in-place is lifted. But, we probably will have those same conversations that everybody has. what restaurants would we like to go to, or other places that we'd like to go to. I know my kids are itching to get back into sports, but we're going to have to wait a little bit longer for those, which is okay. You know, just the normal things that other families would be talking about.
Yeah. Well, Dr. Garza, thank you so much. We appreciate your time this afternoon. We'll definitely be checking back in with you on Monday.